There was an interesting study done in the 1950s in a small town in Roseto, Pennsylvania. Small, first-generation Italian immigrant community where people were it was a very close-knit community. And you can see they didn't take care of themselves. Chain smoked, drank, didn't exercise, ate a red meat diet that was higher in fat and cholesterol than the typical American diet, which at that time was even higher than the typical American diet today. And theirs was even higher still. They worked in mines. Levels of obesity and hypertension were equal to those in surrounding towns. The most interesting piece about this is they lived in 3, occasionally 4 generations per household, which was not unusual for the way it was in the old country. The research team, this is what they concluded. The piece that really stands out here is it's about community, social support. Everyone in this town knew everyone else on a first-name basis. They all looked out for each other. Elders weren't cast aside. They weren't put in nursing homes. They were revered. And the people there had far less disease than anywhere else. Despite their terrible health habits, they had 1/6 the heart disease of the rest of the country. The researchers came back 20 years later. They wanted to do a follow-up. Well, things had changed because the community had become upscale. It was now suburbia, typical suburbia. People drive home from work, drive into their garage. They don't know their neighbors. They don't have no clue who lives next door. The interesting thing is the people now living in this now suburban town were taking great care of themselves. They were doing everything right. But they had higher rates of heart disease and cancer. So, if you think back to people in the older community, they all knew each other, looking after each other. That's, I think, what made them healthy. It's just something to remember.